All right, everybody. Hello. I hope you can hear me this time. I have a microphone on me, so I hope this works. This is a little quick wrap up I'm going to do on intracranial pressure. So right here, this is a part of this section that you have for exam number 2 at this point of me recording. So I'm just going to use a little scenario. So I don't draw very well, so we get a stick man. So this is a 43-year-old male, and he was in a motor vehicle accident. So this patient comes into the emergency room, and you're an ER nurse, which I hope you can see me. I'll move over here. You are an ER nurse, and you are assigned to this patient. And of course, you're going to have a team working with you. But remember, for exam purposes, we still have to know what our priorities are, even though things are sort of being done as a team and at the same time. All right. So this guy comes in. What's the first thing you're going to do? Think of your ABCs, airway. So we're going to put oxygen on this person, because if we have a motor vehicle accident, we're thinking trauma, right? And we want to make sure that your tissues are perfusing, that you're being oxygenated. So that's the first thing you're going to do. The second thing you're going to do, excuse me, is you're going to check the level of consciousness. So how are you going to do that? You want to do a Glasgow Coma scale. So it's to determine the level of consciousness. So would be the most severe. That would be mild decrease, and or moderate decrease, and this would be a mild decrease in pressure. So when somebody comes in with trauma or a motor vehicle accident, what are you suspecting that's going on? So you're thinking, did this patient have a head injury? Did he hit his head? Is there anything open? So you're thinking trauma, right? And if they do have a injury to the head, that's the first thing you got to do, is go right here thinking that maybe they have a hematoma, subdural hematoma, or something of that sort. So this patient, number 1, oxygen. You're doing the level of consciousness. In the meantime, you're checking vital signs. You are doing neuro checks on this patient, and you want to get this patient to CT scan as well as x-rays. So you're going to get x-rays of the head. So x-rays of the head and the spine, right? So C-spine, spine, because you don't know where the injuries are and what's going on. You got to get a CT scan of the head. An x-ray can see if there's a space of fluid, but really the CT is more specific in telling you exactly where the fluid is, or blood collection, I should say, with the trauma patient. So in the meantime, you are also going to check for other signs on your patient. You're immediately doing an assessment. So remember, what else are you going to be looking for with head injury? What happens when they have clear nasal drainage coming out? That's the halo sign. I know that's a terrible picture, but sometimes pictures help you remember. Look up the halo sign, make sure that you understand that. That is not a good sign. All right, so this patient probably has increased intracranial pressure, right? So let's just say that you check the blood pressure. It's 158 over 62. The heart rate is 64. And he has a GCS of 14 at this time. So at this point, you're waiting for the CT to come back. You've done your assessment. He's got his oxygen on. He has IV fluids going. You're doing neuro checks about every 15 minutes, because remember, your level of consciousness is the most sensitive and earliest indicator of increased intracranial pressure. All right, so remember that. So level of consciousness is very important. Yes, you can see changes in blood pressure and stuff, which is also important, but just know that level of consciousness is the most sensitive indicator of that. And they're going to have an IV line, etc. Okay, so this patient has a CT, and it comes back that they have a subdural hematoma. What are you going to prepare for? This patient needs to be prepared for an emergency craniotomy. So if he's got, which I'll get my other marker here, which I don't have red, I lost it. He's got a blood collection right here of blood. So that needs to come out. That needs to drain, because remember what's happening. He has trauma. He's got brain swelling most likely going on, and now he's got this bleed going on. And so that's going to cause your level of consciousness to go down, right? Because he has this increased intracranial pressure. His brain's not able to perfuse adequately. So he needs to go for an emergency craniotomy. And especially because now you notice his level of consciousness is going down, and his Glasgow Coma scale is now down to 10. So he needs to get to OR right away. And at that time, they put in a ventriculostomy, and that checks for the intracranial pressure. So now at least when this patient gets transferred to your floor that you're now working, you got floated as an ICU nurse, which usually doesn't happen if you're an ER nurse. But anyways, it depends on where you work, if it's rural. The normal is 5 to 15, so you're going to be monitoring that at all times. So let's just say this patient comes back and he's very stable, and the ICP is staying right around 10, and vitals are stable. But let's just say you look at the monitor and now you notice that his intracranial pressure is like up to 16. What are you going to do? Or 17, or even going up towards the upper limit of normal? You're going to suspect increased intracranial pressure. Level of consciousness is probably going to go down, and you need to call the doctor right away for that. You don't want to mess around. What is another way that you can decrease intracranial pressure? Medication. So IV diuretics, meaning specifically mannitol that's used as an osmotic diuretic. Lasix doesn't work for that, but the IV mannitol will. So they may be getting that. They also may be getting corticosteroids around the clock also. You want to not increase intracranial pressure. So with this patient, you want to keep him calm. You want to give him pain medications. What if you have to move him and he's in pain? Make sure pain medications are on board. Keep the head of the bed up at least 30 degrees. Excuse me. And you're going to monitor the blood pressure, obviously, to make sure that there's no increase. So it's going to be really important to watch vital signs. What if you have another patient that had a trauma, and his GCS is 3 or 4, and they determine that he has some, extensive brain damage from this trauma? Then what are you watching for? Not only are you watching, you're just basically caring for him and maintaining as much as you can, and watch for posturing. Remember, decerebrate, decorticate. Decorticate is when you're going in, decerebrate is when you're going out. So make sure that you understand that, and that's permanent damage usually to the brain. All right, and I think that's it on increased intracranial pressure. If you have any questions, you just let me know.